I'm Dr. William Starjak here at Starjak Osteopathic Clinic with Alyssa McDivitt. Alyssa is a nurse practitioner. I'm her collaborating physician. And we decided we wanted to have a conversation to share some knowledge about around the topic of rebooting health through digestion, but also just to get to know each other better and learn from each other. Alyssa's practice is in Carmel on the northern side of Indiana, and mine is on the west side over by Eagle Creek. Well, how are you doing today, Alyssa?
Wonderful. It's great to be here.
Yeah, thank you for coming in. Thank you for coming in and bringing your camera guy. Usually when I'm doing videos, I just grab my phone and I put it in front of my desk over here. So this is a big upgrade for me. This is really nice. We got lights, we got multiple shots, so this is excellent.
Yes, I am excited. Yeah.
How's the new year been for you so far?
Great. Yes. I am blessed. I'm actually getting myself back on track, that work-life balance, and started like penciling in my me time and trying to get back into strength training again and doing less marathon running.
Oh, wow. I didn't realize. Wait, you're talking about literal marathons. You're not employing a metaphor here.
Right. Yes.
Wow.
And
you're doing less. Like you were doing too much marathon running?
Yes. And that can be hard on the body, as you know. And
yeah, just
as far as gut health goes, it's when you're doing to the extreme, how much that plays a part, with your gut health and maintaining the integrity of the gut lining. And
yeah, absolutely. Absolutely. And most of my thinking around, since we're just get into the digestive stuff, most of my thinking around digestive health comes from Ayurveda. So I got exposed back in high school, and it's really fascinating because this stuff is like 3,000 years old. These texts are ancient, and they had some really insightful stuff that like we're just now beginning to appreciate. When I think of marathon running, mostly I think of the if as far as digestion, I think of like you can get runner's diarrhea.
Yeah.
Right. And that can kind of throw some stuff off.
Right. You never know when that might happen, when you're out there on a run and you can only eat certain foods, and how that really can affect just your whole, like you're saying, digestion, being able to absorb those micronutrients that we may not be getting, to be able to fuel ourselves for a proper workout.
But that's pretty exceptional. I probably think your average American, their issue almost certainly not where you're at, right? With like, I'm doing too much exercise.
Right.
That's a pretty rare circumstance, but like, of course, like can be the issue as well. I think what we run into most of the time is like the absence of exercise. Like that can certainly affect digestive strength. When we look at it from the Ayurvedic perspective, they conceptualize digestive strength as a fire. They use this term Agni. And Agni is also a goddess in Hinduism, but they characterize digestive strength as like a fire, and that's how they look at taking care of it. So really extreme physical activity can lead to a weakening of that fire by an aggravation of one of these governing principles of the body. So they call these doshas. And that's really the core of this system of Ayurveda. What's survived the British colonization is the tri-dosha theory, this theory of these three main governing principles. Motion called vata, structure called kapha, and transformation called pitta. And they're all represented by different combinations of elements, which makes it seem kind of like primitive and like, how can this be right? Like pitta's fire and water, vata's air moving through empty space, kapha is water and earth. But it's just really astounding how well everything matches. Like with this, excessive exercise aggravates vata, the motion principle, right? Actually, motion. And vata is like a wind. What does wind do to a fire? Well, it can blow it to be stronger, but also it can really weaken it. So what they say is when vata dominates agni or subdues agni, digestive fire, digestion becomes unreliable. It can either be perfect with the worst food, or it can proceed poorly with the best food. So that's one that's kind of interesting. And then they have different like therapeutics to help balance that. But I know you come from a really cool place as well, because I get to review your charts. And that's one reason why I collaborate with a bunch of nurse practitioners, but you're the only one I've done this with. Not that any of my other nurse practitioners are bad, but I thought like the way that you're interacting with people is very detailed, like very, you have a lot of traction with the labs that you're taking and a lot of dexterity with the way that you're interacting to help with rebooting the digestion. So maybe you could share with us a little bit, like everybody, like the background of your philosophy, where your knowledge comes from, and your sort of overarching thing.
I appreciate that. And I would like to talk more about the digestive fire here in a few minutes as well. I had
Totally.
another
Yeah.
question for you. But I would say, well, about 6 years ago, when I was training for a lot of marathons, I had a stress fracture. And so the traditional system kind of failed me. You know, they're like, yes, your vitamin D is low, just take some vitamin D. So, like, maybe at that time I was having digestive issues, but it wasn't expressing through my skin or my mood or my energy or my weight. And so maybe, I was having this digestive issue that wasn't absorbing the nutrients, and I didn't really know much about it at the time. So I ended up finding a functional medicine provider who pointed me in the direction of the Institute for Functional Medicine. And so that's where I decided to start taking the courses, which took about 4 years of study just over time, taking all of the modules and then a certification test. And then I decided, that in traditional medicine, their goals just did not align with mine anymore. I wanted to be able to do a deeper dive into an individual's condition and be able to help them get to the root cause of their problems. And don't get me wrong, I respect traditional medicine because, that's just kind of made me who I am today. I've learned a lot, and there is a certain time and a place for traditional medicine, more so in acute situations, stroke, heart attack, injuries, right? Broken bones, things like that, where you need traditional medicine. But also, alternative health, functional medicine can be an adjunct to healing. And even if it's not, aside from acute injuries.
Yeah, I think it's so interesting, the language that in a sense we're kind of subject to for people to understand what we're talking about, because the idea of like traditional medicine, it reminds me of like how we call conventional farming, where what we're calling traditional and conventional is much more recent than some of these, like some other approaches we'd employ. Like conventional farming, that's since the Green Revolution, when like synthetic pesticides and fertilizers and all of that was developed. But like true conventional farming didn't involve any of that stuff. And some of the principles of health that are just no-brainer stuff, with like taking care of the diet, eating close to the source, like fresh foods, like that's much more, like that way predates our current development of medicine. But when you juxtapose it to like functional medicine, well, some of these more like nuanced molecular discoveries of specifics, like, okay, how can we use glutamine to help support the gut lining? Like, okay, that's definitely newer. Um, Whereas some of that, though, may have been around even in Ayurveda. I'd have to look back in on that thing in particular. But some of these things, somehow they knew stuff that as we're going to study it, it's being proven true. So my favorite one is Krimni. So Krimni. It's the easiest one to sort of immediately get into the world of like, how did they know what they know? Because they described the beneficial bacteria that lived on and in the body like 3,000 years ago. And if you look at like the Western world, when did we begin to know about bacteria? I forget, but I think it was no earlier than the 1800s. It might have not even been until the 1900s. Like, when was the first microscope developed? I mean, 1800s, some people still, like, people thought flies appeared from nowhere, from spontaneous generation. And 3,000 years ago, they not only knew about these bacteria, they knew how to take care of them. They knew about the importance of prebiotics. They knew about the cycling of the seasons and that these things cycle with the seasons, and that they serve these important roles. So yeah, but anyways, that's fascinating. So you were already a nurse practitioner when you had this connection, and you reoriented towards this, towards functional medicine. And now I can see from your charts, is like the mainstay of how you interact with it. Do you want to share like how you approach a patient with digestive issues, or did you want to get into what you were asking about with the Agni?
Yes, I would love to hear more about your perspective on what you think about drinking water before eating a meal. Like, I think that waiting 30 minutes, or not having anything 30 minutes prior to a meal and even after, because the water or whatever fluids may interfere with the digestive process, and just how important it is to get in the right state when you're getting ready to eat. If you're upset about something, I tell people deep breathing. Let's try to get, our body relaxed and ready and prepared. And then, of course, if you're making your own meals at home, right, you're getting the body ready because you're smelling the food and you're anticipating. And so all of those digestive juices are starting, right?
You're basically describing these Ayurvedic realizations. Like, these were established and laid down in Ayurveda back then as well. So I think a lot of, not everything, but there's a good amount of the stuff that'll show up in integrative medicine or functional medicine that's not new, that wasn't discovered like recently. That's like repackaged. Some stuff is new. Man, I love tangenting. I'm gonna try to rein it in and stay on this. But I agree with you with the water. That's one of the things in Ayurveda. And anybody who knows any chemistry knows that if you dilute an acid, well, then you are going to slow its activity. So it makes total sense. If you're about to need acid to digest the proteins that you're going to be eating, well, why dilute it? You're just going to have to produce more then. So ideally, from my view and my understanding and the recommendations in Ayurveda as well, is 4 ounces of water with a meal, nothing more, and not ice water.
That's putting out the fire, isn't it?
Yeah. If you want to slow a chemical reaction, cool it down. If you want to speed it up, warm it up. So this is a really good point to introduce another concept in Ayurveda called AAM, AAM. And this is basically incompletely digested food byproducts. So anything that hasn't been processed to its end and been able to be dealt with well. So if you think about like your house, the stuff that can kind of accumulate in your house, there's common areas like maybe the washing room or the sink, but then you'll get like dust accumulating along the edges. You'll get the areas that we don't think about as much that have to periodically be cleaned. So can express in the body in different ways. Arterial plaques are one expression of even I think we can consider the things that happen in the brain with the amyloid. Yeah. The amyloid plaques can also be considered an expression of If you look at individual cells will have little trash pits. They'll have areas of debris that when they are in growth, they won't deal with. They'll just let build up. It's only when they're tipped into repair through fasting or through like a fasting mimetic like rapamycin, which is gaining popularity, that they'll begin to break down those things and clear them out. And so in the Ayurvedic conception is like the seed of disease. So that's why they start with looking at digestion and taking care of digestive fire, because we either generate it through the fire's just not strong enough and nothing we eat is going to be fully processed. So we're going to create or the fire's strong enough if we eat the right stuff. But if we throw a big wet log on that fire, it's not that strong. And so it won't fully burn up that log. And so that's a lot of Ayurveda is about learning, well, the etiquette of how do we eat, when do we eat, what combinations, what for our particular constitution type. But also how to strengthen that fire so that we have more freedom in what we can eat. We don't just give up eating all sorts of things for the rest of our life.
Yeah.
So does that touch anywhere? I haven't taken any formal functional medicine courses. I've self-studied. But do they have an equivalent of Do they have that sort of concept? Have you come across it?
No.
So it hasn't been unified, but all the individual things are there with the plaques, all the individual expressions, just not the fact that these are all sort of kind of have a similar root.
Right.
But I bet you have approaches that prevent its formation, that strengthen digestion.
Yes. So depending on, I really like doing a gut health test on someone just because you can see the pH and look at their like pancreatic elastase, like if they're secreting enough enzymes to break down their food. Because I guess, the end result is if they're not breaking down the food, then it can also end up, feeding the bad bacteria as well. Have you
Oh yeah.
heard
Yeah.
that?
Like the bacterial overgrowth, the SIBO, small intestines, bacterial overgrowth. And then that's where a lot of food sensitivities will come from because they can create these inflammatory mediators.
Yes. And what do you think about the antacids that a lot of people are put on for very long periods and how that can affect, the landscape of the.
One of the things that's wild to me, like I don't understand how we can even do that and people don't have more obvious problems. Like how can we because a proton pump inhibitor dramatically shuts down acid production. It doesn't just decrease it, like it really, and how are they still like not immediately having issues? That's one of those things that just on face value, it seems like it should be worse than it is because the evidence isn't terrible for them, but it's obviously not the ideal. What sort of approaches I know I have some stuff I do, but what sort of stuff do you do in the case of GERD or of gastritis or even like full on ulcer?
I know that zinc carnosine has been known to be very helpful with the gastritis. And like you were saying, L-glutamine, other things to kind of calm down, marshmallow root and aloe.
Oh, yeah. That's used in Ayurveda.
Diglycerized licorice.
Yeah, licorice too. Marshmallow, licorice, slippery elm is a common, you make a decoction. Yeah, cool.
And I guess some of that, can be teas, right? You can drink it as a tea or supplemental form.
There was some research that came through. I like New England Journal of Medicine does this journal watch thing. Do you use that? So cool. So they had one come through where it said if someone removes simple sugars from their diet, the effect on GERD is equivalent to taking one of these acid inhibitors. Or if someone reduces their plant protein intake to no more than 10% of their diet, also same thing.
Wow.
So like either one of those, like, so get more, obviously you don't want to just get a bunch of carbohydrates if you take out animal protein. Did I say reduce plant protein? Did I say produce
Okay.
animal protein?
You meant animal,
I
right?
meant to say animal,
Yeah,
but yeah, if
yeah.
you reduce
Like,
animal protein
yeah,
down to
yeah.
10% of their diet, so you increase plant proteins,
Yes.
then you'll get that same effect. But that's cool though. The overlap with that we come across the same thing. The zinc carnosine though, that's a new one for me. I have to look into that.
Yes. Yes. Helped strengthen, yeah, the integrity or the lining.
Mm-hmm.
And I'm trying to think if it was like 17 milligram. I forget what the strength was exactly.
Yeah. Well,
Yeah, but you know.
yeah, well, there's plenty of things that I look up. Einstein said, like, why, if you can look something up, there's no point in
Yes.
memorizing it.
Yes.
A newer one, you ever work with or have heard of BPC?
Yes,
157?
BPC 157. I guess
Mm-hmm.
it can heal and seal the gut, and you can pulse the dosing, right? Kind of off and on, maybe use it temporarily for 3 months. And I have read some of the scientific research on it, but then you also have to be careful in certain populations because it can grow, right? Grow and repair. So if someone has like tumor or something, you just have to be cognizant of that.
Digestive lining, yeah. But it's bioidentical. So it's produced by our stomach cells. And this
You
was
were right. Yes, the gastric
investigated.
secretion or something, right?
Yeah, yeah. This was investigated. It was like, I don't think I'm mistaken on this. It was a Cold War thing. This was Russia. Like a lot of the peptides were investigated and used in Russia, and they're approved there for medical usage. But here, we have some peptides that are approved, like the GLPs are peptides.
Mm-hmm.
Sermorelin,
Yes,
which is for
umbrella.
growth
Yeah.
hormone deficiency, that's been
The
FDA approved. But most of the peptides like BPC, ipamorelin, CJC,
pentadecacetate, which is similar to the
yeah,
BPC.
those aren't even like they haven't done any FDA stuff for them here.
Right, right. And
Mhm.
I know, I think it's harder to get the BPC 157 right now, possibly.
Yeah, the FDA just made that new rule that it has immunogenic potential, and so it can't be injected or taken sublingually, but you can still take it by capsule. And what I found interesting is I kind of took someone's word on it early on from a compounding pharmacy that BPC could not be absorbed by the intestines orally.
Oh, really?
Yeah, and that's not true. After we lost access to injectable and troches with the sublingual, I looked it up. It's like, no, it's absorbed really well.
Oh, wow.
Like you can totally use it that way. So it doesn't really matter that they took it away for injection because just take it orally. It's cheaper.
They were using it in athletes, right? And injecting it into like ankle strains and other strains to try to,
NFL
speed
players
up the
can't
time.
use it though.
Okay.
NFL players can't even use CBD. It's crazy, but yeah, they can't use BPC, that's interesting. But
Well, that's unfortunate.
yeah, right.
I mean, if all across the board, everyone could have access at least to
Because they
have an approach to
steroids, they can use corticosteroids for joint issues, and like, okay, well, that's not even bioidentical, and that's going to degrade the joints and the tendons. So like,
right.
I get like, okay, you can't jack yourself up on testosterone. We don't want everyone doing that. We don't want them to get hurt by everyone doing it. But like, what, CBD? Like what? Like that's really weird to me. These guys can get enough concussions that they're almost certainly going to have dementia. I've seen some of these guys in my training, and I was in Atlanta, a really nice geriatric place, like super expensive, and saw multiple ex-NFL football players. And dementia is kind of par for the course. So it's like, you can do that to them. You can't let them have some CBD. Like, what the heck? Maybe it'd lower their dementia risks possibly by modulating inflammation. But
that's why I wouldn't let my oldest play football.
That's a smart move. I don't want to upset any football people out there. There's some real passionate people, but you got like the verdict, the jury is out, But anyways, I succumbed to the temptation of tangents. We should circle back around to the digestive health. One thing that's really popular and that I've been using some of, and I'm curious how much you use it. It's not my first go-to because it costs about $500, but doing the microfloral studies, looking at what do they have, what the balance is of the main classes. Do you do much of that?
No, I mean, just mainly the gut health testing, but you're talking about, tell me more specific
What
about
do you
like,
do when you do gut health testing? What you're looking at, you said the elastase, the pancreatic enzyme secretion, which, by the way, I did want to circle back around to that, but I got onto something else because the in Ayurveda, they don't have a way to assess through lab work. They assess through pulse. Like insane what they can do through pulse. But then they use herbs to stimulate pancreatic enzyme secretion. Triphala, Tricatu, they're different bitter herbs, musta, that they'll stimulate, as opposed to this a common philosophy that I see some of the times when people come to me is they say, "Oh, I prescribe these enzymes, so I take these enzymes for my digestion. And so long as I take them, I do better." But that to me is very much a surrender. That's like, yeah, that's good for a period of time, but why doesn't John have to take enzymes? Why doesn't Sally have to take enzymes? Why do you have to take enzymes? Do you have a genetic disorder? Like, do you have your pancreas is irreversibly like damaged from something? Like, surely your pancreas can get back up and running and produce its enzymes. So in Ayurveda, that's very much their perspective of like rebooting and building that, as opposed to someone getting sort of standing on a smaller and smaller piece of land until they just give up all these different things and they have to take all these things to do their body's job for it. So I wanted to touch on that. But yeah, what is included in your when you're looking at it other than that sort of thing?
okay, so I would also like to tag on to that. I think that stress could play a big part in just, the releasing of the enzymes or possibly, um,
I
and the gut brain connection, how that
Parasympathetic,
is.
sympathetic balance. Yeah.
Yes. And so I love the gut health test. And actually, I don't know if we should say specific companies that we use or not on here, but
Yeah.
uh,
Pay us.
but the one I like uses
You don't have to.
shotgun genomics. And so it looks at the commensal bacteria. And then if there's any pathogens and the pancreatic elastase, the pH, if there's any blood in the stool, and also if there's like any fat that is undigested, like undigested fats or vegetable fibers, meaning like just starting from the top, like with someone, are they chewing their food thoroughly till it liquefies? Are they really utilizing what they have to start helping with the breakdown process, and that kind of starts in the mouth, and then also looking at the liver and the gallbladder, and try to think what else is in that test.
Well, that's good that
So
you
I think,
highlight those basics. It's very easy for people who get into functional medicine to get so far down the rabbit hole that they lose track of like the ABCs.
yeah,
And so that's really cool because in our society today, there's just so much like there's such an opportunity to be distracted by so many different things that we really have to be mindful and like tie ourselves to the mast of like focusing on what we're doing. And digestion is directly impacted by, are we available for that experience? Like, yeah, do we smell our food when it's coming out? Do we chew it properly? Do we let ourselves be impacted by it? Um, yeah, that's a really good thing to highlight. I agree.
well, and then people can have other issues that could be affecting the digestion, like autoimmune conditions, as you know, and the migratory motor complex. That, maybe if people are eating more than 3 meals a day, they're snacking, they're grazing, that migratory motor complex cannot do its job. And it's kind of like the housekeeper of your small intestine to kind of sweep out the bits of debris and keep things clean from overgrowing in there. And so that's one important thing to kind of, if that's not working, then yeah, they can get the overgrowth, the bloating, the gas in some cases that I've seen. And, or if they've got like a thyroid issue, that could be causing it, or the anxiety, that they've had childhood trauma, that
Yeah.
could be affecting that as well. Where was I going with this now?
Well, no, no. I was wanting to jump in. I just wanted to finish. Um, so I'm an osteopath, right? There's 2 medical degrees in the United States, MDs, DOs. DOs can do everything MDs can, but we have a little bit of a different philosophy in schooling, and part of it is around the body structure, the self-healing capacity, the relationship of function and structure, and then the oneness of the being, that we can't understand it by just understanding the parts. We got to understand it in its wholeness. But that migratory motor complex, which is like the conduction, the motion that conducts the food through, regulated by a balance between the sympathetic and parasympathetic systems, or the autonomic system. And right, one half moves it forward, one half, the parasympathetic, when that holds sway, that half of the nervous system, we're ready to rest, to digest. We're at ease, and procreation, right? Sex is part of that too. The other half is about urgency or emergency, which I know you know this, but I'm not telling it for you. I'm telling you for everyone else. And one of the very common sources of disease for people is an imbalance of these two, particularly hypersympathetic atonia, like increased sympathetic tone, where someone is stuck there. And you mentioned childhood traumas and anxiety. Everybody I see who has significant anxiety, maybe a few who don't, but like 95, 99%, their childhood baseline was chaotic. They could not predict. They didn't know when their parent was going to respond in an extreme way. And so they got so keyed up to like sense their environment and be reactive to it, like be in sympathy to their environment, sympathetic, right? So they were too much in that state of always looking for the cues of when is something going to go wrong. And that's their baseline. That's like they're at home. That's when they should be safest. That's when everything should be easiest. And they learn that they have to be like that. And yeah, and that'll cause increased sympathetic tone. It'll show up in the muscular system, where you can see someone like is there physically. Most people learn to control it to where it takes a little bit, but once you get to know them, or first person, they can feel it. And yeah, that learning to let go, and like learning to practice things that open up more sympathetic tone, like different breathings you can learn in yoga, or like different meditations, really helps digestion. Because yeah, if you're relaxed, you're gonna digest so much stronger.
I have my patients work on gargling, singing, or humming to try to get more into that parasympathetic. Just they'll come in and they'll tell me, well, I don't want to go do any mental health work. And they're like, I'm afraid to open all that up again. But I'm like, we need to heal this here, and we can't heal this if you're stuck in, fight or flight, you're constantly on edge, and then we're not going to be able to heal this. So I would love to hear more about, because I've heard, and read about like the cervical stability, nervous system, and how that all plays a part.
Oh yeah,
with
yeah.
That.
So osteopathy's got some beautiful pearls for that, because all of the organs of the body for the parasympathetic system are regulated through the vagus nerve, with the exception of the last third of the colon, the bladder, and the reproductive organs. The vagus nerve comes out from an opening between the occiput, this bone here in the back of the head that has the hole for the spinal cord, and then the bones that house the ears. When they come together, they create a little oval, and the vagus nerve comes out from there, and then it goes down and it innervates all of the intestines. There's a little twist in it because of embryological development, how the organs develop. And then the sympathetic stuff, it all comes off of the thoracic spine and the upper lumbar spine. The lower parasympathetic, there's some like new studies that show like, is it really parasympathetic or not? Functionally, it's parasympathetic, or the sacral nerves. So for those organs that the vagus doesn't innervate. But so treating the sacrum and the head, their natural motion is important for the parasympathetic nerves, because like nothing in the body is wasted. We used to think the appendix was vestigial, right? It's left over. It used to be important, but it's not. New evidence shows that no, it's actually functional. It replenishes gut bacteria after periods of diarrhea.
Yes, I have read that it
Yeah.
actually also like is almost like monitoring. It's a, surveillance area for
Like
immune
system.
regulation. Yeah.
So like these motions that are present that we can palpate, and you can see them when you do serial MRIs. The skull is changing shape, and they're synchronous with another physiologic thing that, like, this is a real deep cut. Most people haven't heard of this, but if you want to like go down the rabbit hole, the Traub-Herring-Mayer wave. This is a wave that represents autonomic variability, the balance between the sympathetic and the parasympathetic. And it's a wave that goes through heart rate variability. So if you do beat to beat heart rate variability, basically the space between heartbeats, how does that change moment to moment? If you graph that, you get this wave that's a 6-second cycle. And it's basically a wave of increasing parasympathetic activity. Blood pressure goes up, heart rate goes up, heart rate variability goes down, and then the opposite. And parasympathetic activity increases. So that's like, this is all real stuff. These motions are present. There are physiological facts that we can link with what we're palpating. And what we find is if someone is jammed up, those things don't have that subtle motion, they have problems. They like reliably have a suite of problems. Problems falling asleep, low appetite, problems with digestion, headaches, low energy, difficulty focusing. When you jam that core cranial mechanism. This is where the term craniosacral comes from. It actually comes from osteopathy. DO took the distinctions from osteopathy and sold courses to massage therapists predominantly and chiropractors. But that's all, he didn't come up with any of it. He just took the work of an older osteopath and sold it. So when you get this balanced and this motion can propagate through the structure more fluidly, then you get improvements in digestion and the suite of things that come along with that. So that's the main, it's because I do that. That's mostly what I do. And then people that I do that with, I provide primary care for as well.
That's awesome.
Yeah, it's interesting stuff, and it's underappreciated in our society because it was pushed to the outside by MDs, because when it arose, MDs were killing people. So back in the late 1800s, you get sick, and MD is going to help you die by giving you mercury, by giving you all the crazy drugs. Like cocaine was really common, cannabis was really common, of course, opioids, very common and overused. Bleeding, that's why George Washington died. He was bled to death. That's a funny story in and of it. Not funny. Now it's funny, but at the time it's the worst. Being a physician and killing someone, thinking that you're the smartest person in the room and using that arrogance and killing someone. But so that's when osteopathy arose. So we were a big threat to MDs at the time. And so the history of osteopathy is one of just being pushed to the outside, not being allowed to publish in MD journals. At one point, California made a deal where all the DO schools became MD schools, and DOs could pay $50 and get a lowercase MD. if they wanted to keep practicing. Yeah.
Right.
Not even an uppercase MD. They'd have to give up their DO and get a lowercase MD. It's like, why do they make that deal? But now everyone's pretty cozy. Everything's pretty good. But DO schools, you can go to a DO and not know their DO, which is the bummer, where they may be just like an MD in practice. But there are tons of schools and there's tons of DOs now. But yeah, so the structural component definitely has a place. And that even ties in with the Ayurvedic principles of addressing the structural balance. Like you can have in Ayurvedic, they could look at it as you can have too much of the structural principle, and that would show up as something like fibrotic, stiff, like immobile, chronic. But you can have too little, and that would show up as like instability, like hypermobility. And the system has a way to tend towards balance, but then you can also apply therapeutics to tend towards balance. So herbs are a common one for that. And it's, again, just really impressive how they knew what they knew. For instance, when people would have like joint pains, they would use this herb, Vidarikanda, and conceptualize it as an excess of vata, motion principle. And Vidarikanda has been shown to have phytoestrogenic effects that stimulate synovial fluid production.
Oh, wow.
Yeah. It also stimulates the gonads. It increases, for the hypothalamus, it increases gonadal hormonal production. So for a man, the male hormones; for a woman, the female hormones. And it's one of the mainstays in balancing vata, especially in the elderly. Somehow, like, they figured it out like thousands of years ago.
Fascinating.
Yeah. Yeah. It's a cool, I think we're in a cool time. Because we get like, we get to span both of those things. We still have access to that ancient stuff. And we have all this new, like, cutting edge stuff unfolding. But I do want to bring it back around. This was the line that we had started on, where we were talking about the bacterial tests. And so in yours, you do check for bacteria, but you're checking for, the commensal. You're checking for all of them. So you have like the main families you're looking at, because you said the commensal.
Oh, and I also forgot about inflammatory markers like calprotectin and lysozyme and.
Oh, that's what same stuff that I was talking about. So you are
Farron
doing that. And then the one that you use, do they do the sensitivity testing?
So there is a company that I have used for sensitivity testing. Well, a couple different ones that I like. Vibrant is one that I guess, I don't know if they're doing away with their food sensitivity testing, but they have a lot of other, they have a gut zoomer in for weeks.
Or like when you have opportunistic bacteria.
Oh, okay.
So
they do have the signature, like bacterial resistance. They do.
And you use the different, they'll like have different agents, like see which one they're sensitive to. Because that's sort of I'm trying to ground it for the people watching. We're talking about like, well, why would we do this bacterial test?
Vibrant Wellness is really good at showing if you have any type of bacterial or bacterial resistance
to antibiotics.
I'm trying to remember which ones, if it was like the fluoroquinolones and the yes.
Well, so there's some that'll do looking at different plants too, because there's certain plants that will sort of be shepherds of the microflora. So there's ones that will support good flora. Like the Ayurvedic herbs, one reason I use the whole herbs instead of tinctures is because the fibers associate with certain bacteria. Like those it's not just the molecules.
Eat those too. And then that's the thing when people, I don't mean to like interrupt, but like with the good bacteria, if they don't have enough from taking antibiotics or whatever it might be, or even at birth, right? Whether they were C-section or vaginal birth, then they may not be able to digest, like you're saying, the fibers, and you need to put the good bacteria back in to be able to.
Yeah, I want to make sure people heard that. Like, our skin flora is determined by our mother's vaginal flora.
Are you seeing that now where they're inoculating the babies or taking the mother's vaginal
It's
secretions? Or
they're
I've
very
heard that.
resistant to it in most hospitals.
Are they still
They're
resistant?
very resistant to it in most hospitals. Birth right now is it's not as bad as it used to be in the US because there was a time when women were chloroformed, but there's still a long way to go. This is like, like the hospital gets kind of jaded and rusty because they're doing the same thing over and over. It's very hard to stay in the freshness that a new parent has. And to be sensitive to that, but also to be the keepers of that. Like to really understand the science, like, yeah, if you're doing C-section, you need to give them the mother's microflora. Like that is scientifically established, but they're just so like slow to catch up to it. That's
That's
a
a funny
bummer.
thing.
But when it like, so I think the take home for these, and again, just for people listening, not for you, because you know this, for the bacterial testing, the opportunity that arises, I think is really twofold. So like one is if we see the good bacteria and we see their distribution, if one is overgrown as one is undergrown, we now know what foods feed those bacteria. So we can make changes in the diet to try to increase the undergrown one or add in probiotics as well. But ultimately, the prebiotics are the long-term thing we want because the bacteria should be self-sustaining. And if we take probiotics, we want to take colonizing ones so that we don't have to keep taking them, but they get in, they colonize, they set up shop. And then if we have opportunistic bacteria in the way, we can see, well, what are they sensitive to? Like the big ones, olive leaf, uva ursi, and then people can use those. Garlic is one, yeah. People can use those and then retest and see. So that's why I said we're in a cool place because we don't just have to rely on the person who can do the pulse diagnosis, which is a very difficult skill, but we can make it more readily available.
I think that's awesome. But yeah, I really, I know it'd be nice if they could do just food first approach or be able to not have to take a test. But I feel like sometimes people come to me and they're like, I've tried everything already. And if they have like bloating and gas symptoms, I feel that they probably need a test just to kind of do a deeper dive and see, they probably have some imbalance and not enough of something, too much of something. And short chain fatty acids, another very important, topic. Just, protecting the colon from colon cancer, making sure there's enough, of that, like butyrate. And of course, you can find it in grass-fed butter and ghee and to kind of support that. But
Ayurveda said the highest substance, the highest nutritive substance is ghee. That was their idea. And they treated their cows really well. Like we don't have hardly any good dairies here. So it's a bummer, right? Because they separate the mothers from the babies. So they cast a whole shadow on that nutritive element. Yeah. It's got to be grass-fed, right?
Yes. Grass-fed all the way.
Conjugated linoleic acid, which is actually cardioprotective, will be 5 times higher if it's grass-fed. You know something interesting? There's a book I want to give a shout out for, Eat Wheat, which is a controversial book title, right? Because in Ayurveda, they appreciated, by the time you're 40, you should be drawing down how much wheat you're eating. Winter and fall, your body will digest it better. Sprouted grain or sourdough is the way to go. Don't eat it every meal. Don't eat it every day. So that's all known in the etiquette. But what happens in our society is it seems like we get one idea, like, oh, wheat can be hard to digest. And then we build a whole system around that one thing. Like, you should never eat wheat. And it's not real. Like, wheat has been part of our civilizations. Like, we wouldn't have civilizations without wheat, most likely. And it's still good. Granted, we've messed it up with all the chemicals that we use in our farming here. I know plenty of people who are sensitive to it here. They go to Europe and they can eat.
And they're just fine.
And
I've heard that so many times.
But the thing all of this extra, what I was bringing up was gluten undigested gluten is turned into butyric acid by certain bacteria. So it's not necessarily a problem that we don't digest all of our gluten.
Ah,
There's all of these fail safes that are built in. We've just gone so, I'll avoid using France. We've just gone so far. We've blown through these fail safes with all of this engineered food that is designed to exploit and monetize anciently created preferences for fat, sugar, and salt. The companies that made cigarettes pivoted to food and weaponized food against us to make money, and just have blown through all of these safeguards to the point where, like, that's why if we just go with our cultural currents, we're going to be overweight or obese. If you just do what's normal and reasonable for our culture, you can be overweight or obese. You're going to have hypertension and you're by your 40s or 50s for a guy. And, it's, and then the pharmaceuticals monetize in conjunction with the food industry. So the weaponized food creates the necessity for this intense pharmaceutical intervention. And it's like the opioid thing. The opioids create the need for the buprenorphine to treat the addiction, and they work together. So it's like anybody who's dealing with it, it's not like just their fault. It's their responsibility, but it's intentional. For a lot of people external to that individual, they have all of these intentions driving them to that location, to that state of disease.
I couldn't agree more. I can't remember. I think it was in the 1970s when that whole corn syrup thing started, which just caused all this sugar addiction, and they knew what they were doing.
Well, they tried to vilify fat. Yeah, the sugar industry tried to vilify fat.
Right.
And then you would have all these low fat things that were loaded with sugar. And I think really, I mean, sugar, period. Refined sugar, whole sugar in moderation. Like, I don't think we need any extremes here. Yeah, like have some maple syrup here and there, have some whole sugar. Like in Ayurveda, the core cleansing process, panchakarma, means 5 actions. I'm convinced you can't do a deeper cleanse. They have a very specific diet you can eat, and there's a series of things you go through that's very particularly designed. You can have raw sugar. Ginger tea with raw sugar is one of the things you can have in between meals. That's not an issue. And they look like the sugar is one of the things, raw sugar, when it has all of its trace minerals and it's got iron in it, it's got some calcium in it, the first product of the pressing of the cane juice and evaporation of it, that's actually considered a highly nutritive substance. And it balances too much of the transformative element and too much of the motion element, but it aggravates the structural one. But like, it's just been twisted. It's been robbed of all of its benefit.
Right.
And made higher glycemic, its glycemic index was raised by the removal of the molasses. Because if you add molasses back into it, you slow down the blood sugar increase. That's why raw is better than
refined.
Yeah.
I agree. Whole Foods.
Absolutely. So you were saying you like it'd be nice sometimes to do the food first approach, but when people come to you, there's enough going on that like you'll frequently resort to like the testing. And I agree with you. Like something I would like for people listening is to understand what they come to their provider with. Because we have to contend a lot with expectations. Like if you really thought, hey, you probably don't need this test. Or me, I'll speak for myself. But I'm curious about your experience with this. I know some people, they just want to be tested. And
Right.
if you don't do a lot of stuff, if you do some sort of common sense stuff first, there's a certain percentage that aren't there for that. They like want the kitchen sink. You run into that at all or
Yes, yes. Because you're like, we could try these things first, right? I mean, sleep. If you're not getting the amount of sleep that you need, that's going to make your insulin less sensitive, right? You're going to be insulin resistant. You're going to be more hungry. What is it? Ghrelin goes up, and then you're just So all these things, right? It's
Yeah.
going to affect your digestion, your timing of eating. So yeah, I try to look at the foundations of health, the nutrition, the movement, bowel habits are so important, right? Because if you're not pooping every day, then you're, taking in those toxins. They're sitting in there longer than they need to be. And you're, increasing your estrogen, or I mean, not increasing, but it's like upcycling instead of getting rid of it. And some women who might have, symptoms that express that. But, and then also beta glucuronidase, that's another important
Oh, yeah.
marker on the gut test that looks at just that. If that's elevated, then that could be a sign that you have the potential of not detoxing, your estrogen properly.
Yeah. So they can become hyperestrogenic, you're saying. Yeah, I've seen some women taking DIM for that purpose. I thought that was interesting. I lean more towards Shatavari, which I think if I could put that on blast, like Shatavari, everybody should know about for, um, especially women, just reproductive health, post-reproductive for menopause. Biphasic, it will modulate the estrogen receptors towards homeostasis. So if estrogen's too high,
Then it's gonna.
it'll help decrease the amount of stimulus the estrogen receptors are receiving because it'll be in the way of the estrogen getting there. It stimulates the receptors, but not as strongly. If it's too low, well, you bring it in and it adds extra stimulus. It's not in the way of the estrogen. It's filling up all the ones that aren't filled up. Um, and so that's amazing. Shatavari, I think it literally means 100 roots, but there's a kind of dirty joke about it that it means 100 husbands. Because if a woman took Shatavari, she could have 100 husbands, is the joke.
Have you ever used it in men? Because it just
Yeah,
makes me think of the men who have
absolutely.
the excess adipose tissue,
Well,
which could be like secreting estrogen or, aromatase.
cognitive clarity for men. Like a lot of guys, especially the ones who are more into lifting, are like scared of phytoestrogens. But estrogenic stimulus is anabolic. Like if you want to grow, you need some estrogen balance.
Right.
You don't want it to be out of proportion. Like if a guy's jacking up his testosterone level, so he's converting to estrogen so much because of the
Yeah.
aromatase you mentioned in the fat,
Right.
then he's got to block that or he's got to stop taking so much testosterone. So a lot of the weight guys, they'll use one of these inhibitors, these aromatase inhibitors. Um, I don't generally think of Shatavari for estrogen excess in that setting. I would go more towards aromatase inhibitors, and then obviously weight loss being the longer term one. For guys, I think about Shatavari for um, anxiety, for mental clarity, and anabolism. If they're like wanting to get bigger, Shatavari can be part of the mix.
Cool.
Yeah. Oh yeah. So you said the beta glucuronidase that's a really important one, and that's how we got onto Shatavari. Oh man,
I know there's so much
it's
stuff to
cool
talk
though.
about.
It's cool.
But
It's such rich ground, the digestive system. Um, so I want to make sure that so we pretty much touched on all of the Ayurvedic principles, like the three doshas and things that can increase and decrease them, and how those. Well, I think this would be an interesting one because people can see this in their daily experience of people they know. So we talked about if motion, if Agni is subdued by the motion principle Vata, digestion becomes unreliable. And then those people who have Vata subduing their Agni have a suite of characteristics that are pretty predictable. Restless thinking. They can have difficulty sleeping, be light sleepers, difficulty with deep sleep. Also, hypothyroid sort of stuff, brittle hair, brittle nails. That's what they thought of historically. But achy joints, relatively flexible, but also can get kind of stiff, like feel stiff, but still have relative flexibility. A lot of difficulty keeping weight, putting on weight, difficulty with anabolism. And so you see in India, it's like they look for having a little more weight on. That's their cultural thing. It's different than us. And also, if you look back at old comic books, buy some comic books from the 80s, you'll see ads of trying to get people to help them put on weight. So I don't know if what was going on in the 80s, maybe, people had more vata excess. Well, cocaine, right? Cocaine is vata excess. All the drug, like any amphetamines, stimulants, psychedelics will all aggravate vata. So that's sort of like intense because it's motion. So nerves have a lot of the vata principle in them, the heart, the intestines. So there's seats for these different doshas, and some are governed more by one than the other. And you can have an imbalance in one more than the other. And different herbs will balance a particular organ more than another one. And then like if someone's excess in pitta, good managers when it's balanced, but in excess, bossy, short tempers, red in the face. They tend to be able to digest anything. And not, vata excess, not the best levers, right? They even qualified that. Pitta, I can't remember. I think pitta, maybe they're pretty good in that domain. But kapha are kind of like particularly good in that domain. Hard losing weight, sluggish, like not as quick, but like when it's balanced, they're visionary. So you can like look at people and you can see these different traits. And if anyone watching is curious, you can take these tests. Like, have you seen people who've come to you who've taken these online tests?
No.
That's one way you can go by those characteristics. Oh. If you can't like find a person who does pulse, like I don't do pulse. I wish I did, but.
I have a couple other thoughts that just came to me while you were talking about that, that we should probably mention. Have you had a lot of people come to you that use mouthwash and they did not realize that it could be bad and killing their good flora in their mouth, which can affect the blood pressure and, nitric oxide conversion?
Yeah, that's not something I end up talking with people a lot about whenever there is something that connects me to it. Because like it depends who the person is, what they're willing to hear from me.
Makes sense.
Like, will they listen to the basics and like, is it going to be fruitful? Because absolutely, that's important. Like, so what do you use in that setting? I know oil pulling is one that I'll go to, but is that your favorite or do you?
Yeah, I think the oil pulling is great. Yes. And then what do you think about tongue scraping?
Oh, I scraped my tongue this morning. I was hassling my wife about it. I was like, I have a tongue scraper for her. It's like, you're not going to do that? She's like, no, it's kind of gross. I don't like to see it. I was like, well, it's grosser if you're eating it, right?
I know. And then, like you said, with the digestive fire, starts that fire.
It's
Or enhances, yeah.
It's a source of absolutely. Yeah. So I wanted to touch on the oil pulling too, because there's a cool, like, we know why that works. Like back then they maybe didn't know why it worked molecularly, but it turns out our saliva causes a change. And it's an enzymatic change, right? Because our saliva has enzymes in it and it breaks the fat down and makes it antibacterial.
Wow.
Just like we make soap out of fat.
Yeah.
So it'll work with like any of your vegetable oils. I don't know if it works with animal fat. It probably would, but I wouldn't want to. Right now you have this whole thing where people are like embracing beef tallow as like a conservative health food, which, okay, I'm vegetarian. But there are animal products that are maybe have some health benefit. That one's kind of wild for me. I wouldn't be ready to like just the conceptualization of swishing. Like ghee is one thing, like I could tolerate that, but like it's like the fat, but yeah, that's how it works. The other thing is, I I guess I'm courting a little bit of controversy for some people, which is good for social media.
Yeah.
The other thing, the tongue scraping, is that in Ayurveda, they also recommend clearing that stuff in the back of your throat in the morning. That is partially the things that your lungs have absorbed or your sinuses have absorbed. And it's not necessarily just your mucus, but it's environmental toxins. I was shocked when I heard, what's his name? Big, strong dude who's a neuroscientist who, Andrew Huberman.
Huberman. Yeah.
Heard him recently saying that for probiotic reasons, you should swallow that stuff. I'm going to go on the record and say, I'm not going along with that. Like, nah, I don't buy it. I don't buy that. That's really, I don't think that you may see some little study that suggests you increase some little biodiversity, but I bet when everything shakes out, you should clear that stuff out. The body wouldn't produce it right there and make it feel like you want to get rid of it.
Right.
Our bodies are so intuitive. Like, we don't get a written owner's manual because, if you're sick, you throw up. If you need to cough, you cough. If you got junk in the back of your throat, nobody wants to swallow that. I think he's wrong. So there's my other courting controversy, taking a jab at Andrew Huberman.
I feel like a lot of people are walking around these days with red flags or their engine lights on and they just ignore it.
I think, yeah, I agree. And I will meet that and I will raise you diabetes. I think diabetes is not just insulin insensitivity. It's insensitivity to feedback. That's runs counter to one's preference.
I agree.
Because that's the only way it continues and develops.
What a great way to put it.
Yeah. I've seen it happen in a person in my family who died before he needed to. And he could go to his doctor's appointment and experience. The doctor said it's all good. But the facts of the matter where the doctor's like, no, this is dire. Like, you need to get your act together. But he could not actually receive that. He couldn't hear it. So I think the disease goes beyond insulin insensitivity. I think anybody treating diabetes needs to understand that the lack of sensitivity is more global. Like, I mean, they'll continue after they've lost a toe.
They will. You're exactly right. They'll keep smoking. They'll keep doing all the things.
And smokers will too, right?
Oh.
Yeah. So maybe it's an addictive component.
I would
is
say
part of it. Maybe it's more like an addiction. Yeah. I mean, yeah. If a smoker gets cancer, they'll generally wake up most of the time. But I see plenty of diabetics who'll lose a limb or lose a toe and they won't. So I try to scare them.
I've tried to scare them too, but it just doesn't seem to work. What's your tactic?
I say what I just told you, and that I've seen this firsthand. Like, you can get, if they're not at the point where they can step on a nail and not know it, I'll presence that to them. Like, I have seen this. I lived with a person who there could be blood on the ground. The dogs could be licking the bottom of his foot. And he doesn't know that any of that is happening. The nail is still in his foot and he's sitting there eating a salad. I mean, the salad is this big and it's loaded with all of his stuff. So it's like, it's not the thing. So I'll do that. I'll also talk about sex. Like, imagine, I use the idea of an external demon. Imagine if there was a demon that was robbing you of the ability to have sex. Wouldn't you be freaked out? Like, wouldn't you be trying to figure out, how can I get rid of this demon? You'd be like on edge all of the time. And like, that's like what diabetes is. It's like there's a demon that is eating away parts of you. It starts with your nervous system and it's eating your vascular system and it's whispering in your ear like, everything's fine, just keep going. It's like this, I think, trying to shift the conceptualization to where they wake up and feel like there's a thief in their house. Because really, if they get it correctly, they should be really scared. Like, it shouldn't be a subtle thing like, oh, we got this, it can be better. It's like, no, like, this is horrible. Like, that's kind of where I have to try to go with it, when we don't really get trained do that with people. Like usually we kind of stay pretty clinical and not very emotional.
Right.
But I think that's really what the main causes of death in our country, the top 5, are lifestyle, are at
Preventable.
the root. And knowing is not enough. Like the physician just knowing what the person should do, that's hard to know all the things of what should be done. But it's just the starting point. Like we have to inspire. And that is not taught in medical school at all. In rotations, if we're lucky, we get physicians that see that and that try to give us their wisdom on how they learn through experience to inspire. In Ayurveda, there's a story that encapsulates this idea, this exact idea, where there is a Vaidya, which is they know pulse diagnosis. They're called a Vaidya, traveling with his student, and they stop for the night, start a fire. They're kind of off the road, but close enough that another traveler, it's getting dark. He stops and asks if he can join their fire, and they let him. And they're all talking, and this guy ends up finding out they're these Ayurvedic physicians, and so he's sharing with them like anyone does, right? If you meet a doctor, like you're gonna start, people will start telling you,
I know everything, their whole life history.
yeah. So that's what this guy does, and the immediately the student is like, oh my gosh, I know what he needs, and so like is really excited and jumps, is like, you need this herb, you should take this herb, and the guy's like, okay, whatever. Kind of ignores him like this like young whippersnapper. And the older Ayurvedic doctor doesn't say anything about it. He just kind of like shrugs it off and keeps talking with the guy. And he knows it's exactly the herb he needs to take. But he's like teaching his student in this circumstance. And doesn't say anything that night. Next morning over breakfast, doesn't say anything. But when they're parting ways, after like they've developed the connection, then he gives his prescription. He's like, hey, by the way, I think really like this would be a really good thing for you to take. And like maybe he gives him some of it or something, or just writes it down for him. And the guy received it and actually started taking the medicine.
Oh, wow.
And so they knew that back then. They enshrined that, how important that is. It's really the difference between life and death. And I saw that recently. I had a failure recently in that area where a patient had atrial fibrillation, didn't trust medical doctors, had plenty of people telling her she needed to take an anticoagulant, came to me because I sort of am positioned differently. She thought I might agree with her that she shouldn't. I didn't agree with her, but I was very patient, saw her a few times, brought it back up in like gentle, indirect ways, eventually became more and more direct and like let her know like this is a life or death thing. If you don't anticoagulate, your heart could throw a clot, you could die.
Yeah.
Said that, like saw her a couple times after that direct conversation, reviewed it. She wouldn't take it. She's dead. Yeah, it's sad. Like, so like we can never be perfect with those skills, but we always have to try to get better, because it can literally be, we can have the answer, but someone won't do it.
I agree, especially with family members. Like you can tell them, they want to ask your opinion, and then they don't want to do it, but they want to go pay someone else to tell them the same thing before they'll.
I'll get it where like sometimes if people see me as just the manual work, the like osteopath table work, they won't listen to me. They'll listen to their massage therapist. They'll listen to their aunt. They'll listen to their cousin. It's it's potentially frustrating. Yeah.
Yes. I could see how that could be.
Right. Well, you said you've experienced it. Yeah, you've seen it too, right? Where
Yeah. I know it's hard to convince them when they are set in their way and they have, they're going to do it this way, and it's like, okay, no matter how many research articles or tell them, hey, that if you don't go this route, this and this and this can happen.
Yeah.
You can only do so much, though. I just feel like people do need to take responsibility for themselves, too. I mean, we can only do so much. We can't make them. That's the bad thing.
Y- yeah, I think the one thing I always want to avoid, if possible, is if I can't help someone, blaming them, because it's like, all right, well, I could be more masterful. Like, I'm not going to beat myself up. Like, I'm not going to say, like, okay, if you're playing basketball, right, we're not going to win every game. But that doesn't mean Michael Jordan doesn't go back and look at the tapes and get better and better and better and better. He's aiming to win every game. And like, I think I've run into a lot in my training, doctors' egos, we can get our egos affronted by the patient not getting better. And then we can blame them for that. It's their fault they're not getting better. And it's like, yeah, maybe, but what's the point of saying that? Like, that doesn't make me any more capable. But we got to let ourselves off the hook, is what you're saying. Is what I hear from what you're saying, is that, like, we can't, if someone doesn't listen, we can't, like, throw ourselves into depression. Like, because, like, this woman died. Like, it's like, I did what I could. I'm going to learn from that situation. And next time I'm going to tell someone, hey, I've been around this block. Like, this is what happened in this conversation. And, like, maybe I'll, like, do better next time. And so that's one of the things about medicine that always appealed to me, is this, like, there's not a ceiling. When you look at these other skills, like, you can keep getting better if one's willing to, like, take on the responsibility of saying, yeah, maybe it's not my fault, but I can respond to this.
Right. Do everything you can and make the most of it. And yeah, I know. I think after tragic experiences like that, when you've lost a patient, or it makes you think, right? Reflect and
Yeah.
see what could I have done differently? What can I do better next time?
Yeah. This one looking, yeah. Yeah. I think the biggest thing will be the fact that it happened for me. That'll be the biggest thing that can make it different next time, is I can actually say, hey, this happened in 2020, the beginning of 2026. This thing happened. So don't be that person. Like, you may not like prescription medications, but there comes a time where, like, it is the thing.
Right.
Like, it's definitely the thing. Which we, open this up with. And we are coming to the point where I think it's good to start to wrap stuff up. Is there anything that you still have in the chamber that you were thinking? I know I get overly excited. And I can just sort of suck all the air, I get like yeah, I won't pull that analogy, but is there anything that you still had that you wanted to talk about, to bring out, to address? Because we still got some time.
I don't know. I'm trying to think. Is there anything that you can think of that we missed, or that we didn't?
I could always either go on some tangent or bring something up. Something for our listeners and for you is, my compulsion is information sharing. I think at a young age, I got at some level that I could demonstrate value by acquiring and sharing information. And then I just really invested in that. And so in a way, it's an expression of some sort of trauma, right? Like, we all have these events where life looks different after it. And it's like, this comes from the Landmark Forum, the world is blank and I'm not blank enough. And I think some story I have there led me to just be compulsive with information sharing, to sort of, like, prove my worth in some way. But it works in this field. It works in this field, and in podcasts, it's very functional. So other than I may not be as good always with the give and take in conversation. So did you have anything on your list that you wanted to bring up?
I feel like we covered everything as far as digestion, but just the other little, things that we can add in, like the little habits, right? That we can do every day to make a difference with our digestion, just like sleep, movement, grounding, with either grounding mat or outside barefoot, walking
Yeah.
in the woods with nature to try to bring balance into our lives and kind of bring that parasympathetic system into play. Drinking a lot of water, clean filtered water. Um, what do you think about water? Have you heard of the Kangen water, the alkaline water? What are your thoughts on that?
I haven't heard specifically of Kangen. I've definitely like been around the block with all the different water stuff and all the different ideas. It's so important, obviously, right? Should we be drinking water with pharmaceuticals in it? Like trace amount of pharmaceuticals?
Yeah.
Like there's maybe not all homeopathy works really reliably, but there's something there to like a small amount of something can have an outsized effect. We see that with vaccines. We see that with allergy shots. So should we be exposed to the pharmaceuticals that are present in our water? Tap water or city punch, as I like to call it.
Oh.
Or the maybe I got that from someone else, like a comedian or something. Or the PFAs that are in there. So I think water, very important, very worth investing in it. And it can be expensive is the problem for a lot of people. A lot of people don't have the money to put towards like buying glass, like spring water in glass jugs. Right? That would be
Yeah.
my ideal. Deep aquifer spring water in glass jugs in an area that hasn't had contamination of the aquifer. Or I would say I have no problem with distilled water. I have no problem with reverse osmosis. I do not buy that we're going to leach our minerals because we do not get our minerals from water. We get so much from food. Water should be negligible. The minerals are just about taste. So that whole conversation, I don't know who came up with that or what evidence there was behind it, but I've never seen any proof, you know. I could stand corrected on that. But yeah. What is the Kangen water?
It's alkaline water, so I guess it's supposed to help us absorb our minerals better than just regular tap water. I
A little alkalinity. I mean, that would make sense that you could have some effect from alkalinity, over time. I'm not I'm not aware of the research. You obviously wouldn't want acidic water, but water by itself is just straight neutral, right? It's like pH is like boom, right in the middle. So if you make it alkaline, yeah, I don't know any research about if alkalinity helps. Um, so I wouldn't say no, like, oh, that's bad. But I would say like if standard would seem to be distilled is probably a really good way to go because you can do it at you can get a countertop steam distillation. It's easier to get reverse osmosis to install that. How would Kangen water? Is that like a system that you fill up?
Yeah. Well, yes. I should know more about this, the technical
Do you
part,
use
but
it?
and yes, it has these, I think they're negatively charged. There's a couple plates in there, or several, but yes, and how it runs through for the filtration process.
Oh,
So
okay. So it's got
yeah.
different levels of filtration, then it comes out alkaline. The one that's relatively affordable, I don't know the pricing on the Kangen. Do you know what's the pricing on the Kangen?
I want to say they're like 5 or 6
$100? Yeah, so
thousand, I think. The
1,000? Okay,
machine,
well,
yeah, for the
wow.
machine.
You could buy a countertop steam distillation system that'd be pretty darn impressive for 5 to 6. Um, and then you probably have to replace the filters periodically on the Kangen.
Yes, I'm trying to think if it's every 6 months or I think, well, it probably depends on how
Yeah.
much you're using it too. And
Okay. When I was younger and didn't have as much money as I do now, I used the zero water filters.
Okay.
Initially, I would go to stores and like co-ops and fill up with water. And I would avoid using plastic.
Right.
Because even back then, like at 13, 14, I knew plastic leached and there were issues. Um, and now we're just seeing like all the stuff from it. But we don't know what it's going to do, but it can at least, microplastics can at least help bring in other harmful things like environmental pollutants, heavy metals. They absorb to it and we bring it in. And our brains, by the end of our life, in 2024, there was a study of people who died in 2024. Their brains had on average a plastic spoon's worth of plastic in their brain. So that can't be good.
No.
That can't be good. So plastic, I would always try to cut that out, eliminate that. But I would fill up initially, and then when that became a hassle, zero water filters came out, and those come with ion meters that measure
Yeah.
dissolved ions, and it takes it down to 0 parts per million. So you can test your tap water. In Indiana, it's like 350 because it's really hard water, which is high. You know, New York, I think, is around like 100, New York City. And you can run it through the filter, and then it'll come out 0. And so it filters into a plastic container. So you can move the filter and put it into a glass container. And then that's relatively cheap. The filters aren't that much. You can buy them at Target and you can replace it. Like to me, that's a pretty good way to go for somebody who doesn't have a lot of money. Installing reverse osmosis, that's pretty good. Those last a long time, those filters. You just have to replace them periodically. Or getting a countertop reverse osmosis thing works pretty well. You just dump it out and fill it up, and then you have to dump out the last bit and fill it up because it creates wastewater. But my favorite is actually the spring water in glass bottles delivered. I've done that at times in my life, but it's a little more expense than I always want to do.
So you mentioned the toxins and microplastics, and what do you think about that with digestion then, as far as detoxing or...
So maybe we can close on this thought since we're time-wise, we're running up to our to when we gotta move because I got patients coming in. I think, and I have a video on this on my YouTube, at Dr. Starsiak is my YouTube handle, all one word. And I think that the best approach is combining things that absorb into the bloodstream and can go everywhere, meaning cross the blood-brain barrier, with things that stay in the intestines. So you got that dual level thing. You want something in the intestines that's going to keep you from bringing it in the first place, and then something that can move through the body and hopefully associate with and escort those things out. Now, we don't have any studies that demonstrate that anything does that. We have studies that suggest certain things could do that. So tripala, meaning 3 fruits, Sanskrit, tripala, three, phala, fruits, or tri, not tri. People have corrected me on that before online. It has tannins that will associate with microplastics and can cross the blood-brain barrier. The smaller tannins, I think a gallic acid is the one. And since it's been proven to associate with it, and since tripala classically is a detoxer, it associates with things and then they get excreted. And it's been used that way for thousands of years. Ayurveda, like that's one of their main detoxing agents. All of those things line up. I'm like, okay, cool. That should be one of the things that you take for clearing it out of the body. Hopefully it does that. And then the other one is Shilajit. So Shilajit is high in fulvic and humic acid, also comes from Ayurveda, formed by the same processes that formed the Himalayas. The vegetation got smushed together, pressure, temperature, time formed these molecules. They have all these different little places they can attach to things. And one of them really readily crosses the blood-brain barrier. I forget which of the two does. And in environmental studies, it associates with microplastics. It'll bind them up. So it can go everywhere. It can bind them up. It chelates heavy metals. It chelates all of the things that microplastics could help bring in, like the plasticizers, the heavy metals, volatile organic stuff. It will associate and help those excrete. And there's studies demonstrating that it will do that. So far, no one has done a urinary excretion study with microplastics and Shilajit. Like, I would love to see that happen. And if I had to bet on any substance doing it, Shilajit would be my number one. But I don't know for sure that it would. And then for in the gut, Clinoptila light. which is a type of zeolite, that will associate with it. Not charcoal, because charcoal will absorb all sorts of good stuff. Clinoptilolite will only take the stuff you don't want. It won't lock up amino acids. It won't lock up minerals or other nutrients. It locks up heavy metals. It locks up nanoplastics. It's not as good with just the micro level, but the nanos are particularly harmful. And it's cheap. It's proven for other stuff as well. So even if it doesn't get the microplastics, you still have other benefit. Does this line up with what you're thinking, or do you have some stuff I don't know about?
Yeah, that's awesome. The shilajit, that's really good. And so I'm wondering with that, can they take it close to other things, or do you recommend like taking it a
It
couple
helps
hours
everything absorb.
after?
It's a vehicle. It's in the category of madvahis.
So like you said, it has minerals and everything in it already. So then it will not
80 trace minerals, yeah.
deplete you. Like
Yeah.
some of the things like the activated charcoal.
It'll
that
chelate
I
heavy
have-
metals.
Mhm.
It will
So
not deplete at all. Yeah, it'll increase your ATP production dramatically. It increases fertility. Men and women, it improves hormonal levels and sperm parameters in men. Like if Shilajit was a stock, I would be heavily invested in it. I think if you can afford Shilajit, you should absolutely be taking it, unless you have some medication you're taking that you can't take it for some reason. But you got to get it from a good source, because it can have heavy metals in it if it's not purified.
Awesome. This has been very informative today.
Yeah, thank you so much. And thank you for bringing your guy and all this gear. This is going to look so nice. I'd like to encourage anybody watching, if whether you are or not in the Indianapolis area, you can reach out to either of us and have a consultation, have an appointment. But if you have any areas of interest, it'd be good to put it in the comments, because we can always do future content that's built around that. Please subscribe and like this video. That helps you see future videos, but also helps us get in front of more eyes. Thank you very much. Do you have anything you want to sign off with? Anything you want to say or tell people?
Just thank you for watching. It's been really good today. Yeah, enjoyed it.